Clavicle fracture. The anatomy.
Anatomical structures affected include the clavicle, sternum, and AC joint. 3 types of fractures based on location, most common being in the middle of the clavicular shaft. Usually surgery is not required unless ligaments have been torn, such as the AC ligament. A patient may develop a frozen shoulder during recovery, which is where their shoulder becomes so stiff that there is limited range of motion. This can be treated with physical therapy.
Mechanisms of injury. The common mechanisms of injury of a clavicle fracture is for the person to fall onto their lateral shoulder. Another way a person can fracture their clavicle is to fall onto an outstretched hand. The fall is usually very forceful and most often occurs in contact sports. Another common way to fracture your clavicle is in a car accident. And one that doesn't necessarily relate to sports injuries, but one that you may not have thought about is another way you can fracture your clavicle is a baby passing through the birth canal. Populations affected.
Can happen to anyone but occurs mostly in children and adults 25 and under because the clavicle doesn't harden until around the age of 20. Also common in men over the age of 55 and women over 75.
Common signs and symptoms.
Presents with head tilted towards injured side with chin facing away and supporting the arm affected. Clavicle may appear lower. Palpation reveals pain, deformity, swelling, and point tenderness.
Levels of severity. Clavicle fractures are divided into 3 types based on the location of the fracture. If the clavicle is fractured near the sternum, this is less than 5% of clavicle fractures, and it is very unlikely that your clavicle fracture will be here. Clavicle fractures near the AC joint are the second most common of clavicle fractures. The most common way to fracture your clavicle is in the middle part or the shaft of the bone. This usually breaks or fractures halfway between the sternum and the AC joint. Injury management. A clavicle fracture is managed by wearing a sling most often because it immobilizes the arm and shoulder while the clavicle heals. If the fracture is severe enough and is complicated, the person may need surgery to realign the bone pieces. Rehab for a clavicle injury is usually physical therapy along with medication to relieve some of the pain. The physical therapy will maintain arm motion, and this will also make sure that stiffness is not developing. Length of recovery.
Recovery depends on age, location of fracture, and how many pieces it broke into. Children 8 and under take 4 to 5 weeks, adolescents take 6 to 8 weeks, and adults and teenagers 10 to 12 weeks. Typically, fracture will heal completely in adults by 4 months. Most patients have full range of motion and can return to activities with no limitations.